The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health educational purposes only, and complies with all HIPAA regulations.
Hello folks, I'm Dr. Fazil. You're watching January 2025 Dr. Fazil TV show. I hope you all have a good year, and this is going to be a better year, good year. With that, having said that, let's do a quick discussion about burning and tingling in the legs, commonly known as neuropathy. But not all causes are due to neuropathy. Neuropathy means that there's a, oh, by the way, I'm Dr. Fazil, internal medical specialist and kidney specialist at the same time. But the topic for discussion was, as I said, the neuropathy, right? So it's a very common problem. A lot of patients have it, and neuropathy is just pain in the nerves of the legs. I mean, you can have neuropathy in the hands too. I mean, that's less common. Mostly it's the legs, or in the feet, right? So, but as we said, it's like having a symptom. That's not a diagnosis. It's kind of diagnosis, but it's have different reasons. So when we say you have neuropathy, or patient says I have tingling and numbness, it could be more than just the nerves. It could be a blood flow issue. Sometimes you have poor blood flow to the legs. It can also cause burning, especially when you walk, and it can present as like it is coming from the nerves. But quick discussion or good examination diagnosis can be established by your provider, or we might have to do some diagnostic modalities like nerve connection study or nerve check. We call it nerve check if it is a neuropathy. Or sometimes you can have combination. It could be a little bit of both, or a little bit of three other things. Like it could be the veins. Veins are the blood vessels which take the blood back to the heart. I think before we move forward, let me give you a little bit anatomy update on the legs of the human body. So as I do all the time, I'm going to bring in hologram to have you better understand. So let's bring this hologram right here. This is the hologram, and I'm going to stabilize it right here. And you can see this is actually the leg, and that's the foot. So here we can see this is blue thing, that is a vein, and that actually take the blood from the feet back to the heart, and the dirty blood, we will call it dirty blood. And then the red blood vessel coming down, going to the foot, is artery. It is bringing clean oxygenated blood from the heart, and then it make a loop in the foot and go backwards, right? And then we have the nerve, the yellow nerve. You can see all these fibers that are coming in, all the fibers, different fibers going in different directions. These are like electrical wires, and they are your nerves, right? Like electrical system of the body. They take the sensation from your feet to the brain, and then bring the impulse from the brain for the muscle to contract, right? So if you have weakness in the legs, that could be also due to neuropathy, but that's a different kind of nerve. The nerves are two different kinds: sensory nerves and motor nerves. Sensory nerves are which take sensation. So the neuropathy is typically from the sensory nerve inflammation, the damage to the sensory nerves. And the motor nerves, if it is have an issue, that's generally due to that cause weakness, like paralysis and or other kind of neurological disorder, which is not in our scope of discussion today. So let's park this hologram on this side, and then we will use that hologram later if we need to. So let's bring another hologram, and I'm going to show you a little bit more in depth how the nerves really works, especially the sensory nerves. We call them dermatome, right? So there's another hologram you can see, and you can see this leg, and it has different kind of like a map. Like a map drawn on it. It's kind of like a diagram, and you can see L5, L1, L2, L3, L4, and L5 and S1, and then you can see, and let's park that on this side. Let's see another hologram, and this is the back side of the leg, right? And it has a similar pattern, starting from L1, L2, L3, L4, L5, S1. So let's plot that hologram on this side. So now we can see that we have this map will show you, well, L5, L5, L4, L, all these levels are your level from your spinal cord, right? So your spinal cord is like a big fiber with the optic, like a big track from the brain, and come all toward the tail of your tailbone, and then it kind of branches out and goes to a leg in a different fashion, and it supplies different part of your leg skin and different portion of the legs, and by just do a quick neurological examination, you can see what level is involved. Sometimes you're not sure, and sometimes multiple levels are involved. Sometimes it could be more than just neuropathy. It could be due to circulation issue, right? So then doctor have to check the circulation, with the maybe sonogram or pulse check on your leg or nerve connection study, and if the source is like lower back, then we can focus on the lower back. If there's any compression on the spinal cord, by doing an MRI, stuff like that. And then again, there's some chemical abnormalities, in your blood, which can also cause dysfunction. But we can go into depth a little bit later, like what are the causes, and then we can see how we diagnose it. Diagnosis, I already told you. That how the neuropathy presents, and it could be confused with the circulation, or both can coexist, and then we have to treat both at the same time. If you smoke, you can have poor circulation. It can present with neuropathy, so like pain in the leg when you walk, if you have varicose veins.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
Let's bring this hologram back with well, as a matter of fact, let's keep it here. Let's bring another hologram, and you can see this leg has varicose veins. Varicose veins mean that blood is going backwards toward the heart instead of going, it's going backwards in the foot instead of going back to the heart. And, you can see the vein is a little bit swollen, and that's why it is causing pooling of the blood in the leg, cause swelling. When your skin stretch, it will cause pain. So that can be easily confused with neuropathy, but that's actually venous pain or venous dermatitis, if the skin gets red. And that's a different problem by itself, and another topic for another day. But, at least you have an idea. Okay, you have three things, You could have four things, It could be muscles too, if you have muscles cramps, that could be due to muscle cramps, and that pain can be presented also with the pain in the leg. That could be due to, electrolyte disorders, calcium disorders, even low blood count, stuff like that. So obviously, that's another topic for another day. But keep in mind that is not very straightforward stuff. So let's keep this hologram on this side now, right? And here, what we're going to do now, let's talk about. Okay, so we have neuropathy topic, right? Then we talked about what are the causes of pain in the leg, and neuropathy is one of them, but not just the only cause. And then, what is the sensory neuropathy, and then the motor nerves, how they act and react. And then the causes, let's talk about the causes. The causes are mostly, I've seen in our practice is the back issue, or if you have some kind of chemotherapy for a certain kind of cancer, it can cause damage to the nerves, right? But there's other causes of the neuropathy as well, like metal poisoning, diabetes is the most common cause. That's why you want to have your sugar under control. Diabetic neuropathy can cause tingling numbness in the legs. That's very important and very common cause. That's why we do emphasize good control of diabetes, blood sugar, because it can cause damage to the nerves over a long period of time, and it can cause pain, right? So most common like diabetes, back injuries, chemotherapy, medication side effects, certain medication can cause neuropathy as well. And there's other complicated neurological disorder, which is obviously has to be dealt by neurologists, and I will keep that on side for now. But the workup could be aggressive, if we can find the common cause. Because the thing is, you cannot treat unless you diagnose. So you diagnose first, then you treat it, right? But history is the most common tool. You take the good history, good physical exam, and then you decide if it is just a neuropathy or more than that, and then you treat all of them or one of them, whichever is the most important source at that time for the pain in the leg. So obviously, if at that time, if that cannot be fixed, then you have to see a neurologist, like a nerve specialist, and they do their own workup and kind of like try to pinpoint the source. But prevention is the key. Prevention is better than intervention, right? That's a common saying. So if you're getting those tingling numbness, try to avoid it. Get seen by the provider first early, so we can see the source and stop the damage, because it's kind of like difficult when you already have it. Try to bring all your sensation back. The other thing is, okay, now we know, okay, so while we're doing all the diagnosis, what could be the treatment? The treatment is, fix the underlying cause. If your sugar is high, get it fixed, And then in the meanwhile, you can take medications which has to be prescribed by your provider. Like most common medication is gabapentin or Neurontin, and that's given to numb the pain off from the nerves, But if it's a circulation issue, that need to be fixed, If there's a blood is not working properly, varicose vein need to be fixed, by using compression stocking. Use compression stocking, at least knee high if it is up to your knees, or higher than knee if it's above the knee. If you have a venous problem, so the blood stays compressed. You can see in this hologram, that's the compression stocking, and it's right around those varicose veins, and it keeps it compressed. If that doesn't work out, you can have the varicose veins fixed, by some vein specialists. They can do a laser treatment. Let's park this stuff here. And I'm going to show you how the nerve connection is done. So this hologram shows these little electrodes, all over here, and then the technician provide the nerve, a little electrical current, and they check on the other side with the machine how fast the current went through. And then again, there are different kind of neuropathy, not just sensory neuropathy of different kinds. It could be, polyneuropathy or mononeuropathy, right? Those are like more complicated terminology, so I'm going to stay away from that. But just remember that it is not just one global diagnosis. You have to be seen by a neurologist to get to the bottom of the problem and get it fixed, Sometimes it could be systemic cause, which can cause neuropathy, like lupus, lupus can cause it too. So you cannot just say it is always diabetes or always like back injuries or spinal stenosis, spinal cord stenosis. It could be a systemic problem, especially if you have the head and your feet and hand involved. Like, diabetes can give you gloves and socks kind of neuropathy or pain. So the treatment, as I was saying, could be gabapentin, sometimes Lyrica, amitriptyline. These are like common medication which are used to numb the pain off. Obviously, they have side effects. So you have to weigh the balance between risk and advantage, by giving, make sure that you're not getting too sleepy, there's no drug interaction with the drugs or medication you're on. And typically, mostly patients take that at night so they can sleep better, and also pain goes away and they're not, sleeping while driving. So that's kind of like, I say my 10 cents or whatever we call it for about the neuropathy. So on that note, folks, I will call it a day. So that was Dr. Fazil TV show. Then I will see you guys back next month with more important medical topics for your daily life, so you can implement those changes in your life and stay healthy. Folks, on that note, I will call it a day. Dr. Fazil, God bless you and God bless America. Have a nice day. Bye-bye.